Hello and welcome back, my friends. If you're new here, my name is Laura and I make videos about hypermobile Ehlers-Danlos syndrome to help educate, raise awareness, and share my experiences and advice living with this condition. Now, today we're doing a special video. I am going to do kind of a day in the life of someone living with hypermobile Ehlers-Danlos syndrome to kind of show what we go through on a day-to-day basis, but more like the little life modifications you wouldn't normally think about, so the really subtle stuff. So I'm just going to kind of walk you through my typical day as if I just woke up, start to finish throughout the whole day. So here we go. So if I am just waking up, just getting out of bed, I have to sit up very slowly and gently with purpose so that I don't get too dizzy. So a lot of people with HEDS have POTS, or postural orthostatic tachycardia syndrome, or some form of dysautonomia where they get super dizzy from standing up too fast. So I take it nice and slow, that way I don't get super dizzy. And then while I'm kind of waiting for my body to kind of reset itself, I also pop my left shoulder. So I usually do this by bringing both arms behind my head and I just kind of yank on the left shoulder and it pops. I'm not really sure what happens while I sleep, but it somehow moves just slightly out of place, like not really out of place, but just enough to where I have to kind of pop it. Otherwise it hurts all day if I don't pop it first thing in the morning. And then after I am not dizzy anymore, I actually get out of bed and I step into my house shoes. So these are shoes I bought from a podiatrist. They have really good arch support, heel cupping. These are Power Step brand, and they're super comfortable. And I can't really walk in the house without these without any pain. So I put these on first thing in the morning, and then I head off to the bathroom like everybody does. And we see my lovely toilet here. Now I didn't clean it all for this video, so don't judge my house. We have a lot of people call this a squatty potty, but this isn't that brand. It's called, I think, Step and Go. If you have Ehlers-Danlos syndrome, you might have issues with pelvic floor, and you can have these issues without any sort of risk factor. So I'm only 34 years old. I have never given birth. I'm not overweight, and so I have no risk factors for pelvic floor issues, but yet I've had them since my early 20s. So that's super fun. I also have baby wipes over there that you can see because my skin is very fragile. It never used to be, but it definitely has been in the last few years. And moving on from the bathroom, I would normally get dressed, and one thing my husband has noticed when I get dressed is I don't take off my shirt like a normal person. So normal people it's hard to do this holding my phone, but they take both hands and they kind of grab the bottom of their shirt and they cross their arms and they just pull over their head. I don't do that, or I never used to. I kind of slip one shoulder out at a time and then I pull up from the collar and slip that over my head. And I was told that is not normal, but it's something that I do so that my shirt doesn't go inside out when I take it off, and it just seems comfortable for me, so that's how I do it. And then when I'm getting dressed, I also have to put on compression socks. So these fun guys here, I have a lot more fun pairs in different patterns and colors, but these compression socks are for blood clot prevention. So I'm not 100% sure that this is EDS related, but the hematologist I saw does think that that is likely the case because I have all of these spider veins all over my legs that I've had since I was probably 10 or 11 years old. I don't have any actual varicose veins like the big snake-like ones, just these tiny spider veins. And they believe it has something to do with the weakness of my veins. I also don't have any other risk factors for blood clots. Again, I'm not overweight. I am quite active, even though I have EDS, and I don't take birth control or anything like that. They think it's related to EDS, so that's what we're going with for now. After I'm done getting dressed, I then take a low-dose aspirin to also help with blood clot prevention, as well as a diltiazem, a lower dose of diltiazem. This is a medication that's normally prescribed for high blood pressure or atrial fibrillation. Now, I don't have any problems with my blood pressure or my heart. I take diltiazem for my esophagus because I have trouble with pain and weird like spasms and sensations within my throat when I eat, every time I eat, no matter what I eat. And so this is something that just kind of helps calm my esophagus down. It really slows down the muscles. And so I take this every day before I eat anything. So at this point, I would take one at the beginning of the day because I'm about to go make some coffee. So I've just made a cup of coffee. I want to show you the way that I would normally hold a coffee cup. So I haven't actually made coffee because this is a fake video, but this is how I hold a coffee cup. So I've been told this is not normal. This is just what feels stable for me to hold on to it. I feel like normal people kind of hold more like this or something, but in order for it to feel stable in my hands, I have to put my thumb like that. And speaking of holding things weird, I also hold pens and pencils a bit strange. So this is how I hold my pencil. I kind of grip my thumb around on my finger like so. And I feel like this is kind of the normal way people do it, but I can't. It needs to be like really locked down. And while I'm sitting here sipping on my coffee, I'm usually sitting in a very weird position. Like, this is kind of one of my favorites where I'm kind of pretzeled up here. But in addition to sitting strange, I also have to switch positions often, otherwise it starts to hurt my hips and my knees and everything else. So I tend to just kind of shift around and just kind of play around with it until something feels comfortable and then just keep switching. And then once I'm actually ready to head on to work, it's time to put my real shoes on. So I'm going to come over here and show you my work shoes. These are a pair of Skechers slip-ins, or step-ins, I think, slip-ins, something like that. And these shoes I can just step right into without having to like pull them on. And the reason I had to purchase shoes like these is because when I was on call with the hospital one day, I was putting on my shoes in a hurry, trying to get to work fast, and in like pulling on my shoe, I dislocated my thumb. And it was super painful, and it hurt for weeks afterwards, and anything doing that pulling up motion really bothered me. And so not only did I had to purchase ring splints so that I could support my thumbs and not let them overextend, I also had to purchase shoes that I could just step into so that it didn't hurt so much to put my shoes on every day. So I purchased these. Well, actually, I think this is my second pair. My first pair was a pair of Kizik's. And then I also want to show you my inserts that I wear. They're a little aggressive. So got these from the podiatrist. Oh, they're a little dirty. Nice arch support, lots of heel cupping. It just really holds my foot in place. And these are actually like a hard plastic. So I really have to wear those types of shoes and inserts in order to not have a lot of pain in my job where I am walking around a lot. And then when I do get to work, I have a lot of things at work that help me out in my day-to-day, and that includes keeping a lot of braces at work. So I have this one that I use probably the most often. It's like a foot ankle brace that really just holds things in place. And I have more than one pair of different styles, but that's usually the one I wear the most often. And then I also have a wrist brace. I also keep several ring splints like this at work, as well as some compression gloves because I'll have pain in my fingers and hands, and that's something that's really difficult to brace. And you also can't really use pain relief creams on your hands because you're just going to wash them off. Plus you can't really touch patients with them, or you don't want to be touching your mouth or your eyes with pain relief cream on. So these compression gloves really kind of help keep the pain at bay. And then I also keep a lot of different medications at work just in case. So I always have, of course, my diltiazem for when I eat. I always have ibuprofen, Tylenol for headaches and migraines, some eye drops, some Tums in case I have reflux. Those are kind of the basics. And then I also keep like a roll-on pain relief cream as well. Speaking of ring splints, I also at work push a lot of buttons because I work in radiology. So when I push buttons, my fingers don't really work the way that they should, and so most people will press a button like this, but of course my fingers bend a bit more, and when they bend they just don't feel very stable. And so instead of pressing a button just straight on, I either press with two fingers like so, or I press with my knuckle is usually the most common way I do it, or sometimes I press with the joint itself. So instead of pressing on the tip of my finger, I would be pressing with the actual joint. So it's easier to demonstrate with my thumb, like I'd press here instead of pressing with the tip of my thumb if I was pushing a button. And then when it's time for lunch at work, of course, I take the diltiazem pill so I don't have any pain while I eat. But I also have to be careful about what I do bring to work for lunch. So I can't eat anything that requires me to open my mouth very wide or to chew a lot, like not necessarily chew a lot, just chew hard. So things like a BLT is probably the worst thing to bring because it'd be a big sandwich that you have to open wide for, as well as BLTs are very chewy. That can just really make my temporomandibular joints, the TMJ, act up quite a bit. They're pretty sensitive. And so to avoid having that kind of issue at work, I tend to bring more soft foods, things that I can eat with a spoon or a fork. And then when I finally get home after a long day of work, one of the first things I usually do is a workout of some kind. Now, in my younger years, I used to go for a run or go take a martial arts class or maybe even go to the gym and lift weights to muscle failure. And that's not something I can do anymore. I'm only 34 years old, but my body just doesn't work that way anymore. So my workouts now tend to look more like physical therapy. So it usually involves resistance training or weight training with lighter weights where I do a lot of reps. And most of these exercises are things that I did learn while in physical therapy that are meant to strengthen my joints and to help protect them from future injury. And after I've had my workout, I then go to the kitchen to cook dinner. So when I am cooking a meal with a pan this size, I always have to hold it with two hands. I can't just pick it up with one because my wrists are quite weak and unstable, and I'm always terrified of like dropping the whole meal on the floor or something, or injuring my wrist, or burning myself, that sort of thing. And then when it comes to opening up jars to cook with, I have to use something like this, like a jar opener, or I ask my husband to do it. Just most things I feel like I just don't have the like finger and wrist and hand strength to open jars by myself. And then once I am finally done cooking dinner, then I can relax and have a shower or a bath. And when I get out of the shower, I tend to wring my hair, and I have to be very careful in the way that I do wring my hair. So I feel like most people can just bring their arms behind their head and like, grab a handful of hair and just kind of draw their arm down their back to kind of wring out their hair. I can't do that anymore. My elbow, when I do that, it snaps in a painful way, and so I have to go very slow and go at a very particular angle with my arm and how I bring it down so that that doesn't happen when I wring out my hair. So getting out of the shower or bath, I have to be pretty careful, especially getting out of a very hot bath, not so much a shower, because when I stand up again, I get super dizzy. And when it's really hot and humid, that is tenfold, I'd say, and I easily lose my vision. I can get just super nauseous. My heart is pounding out of my chest. I'll usually lose my vision for a minute or two, and I don't want to pass out. And so usually what I do is I get up very slowly, carefully, and I step out onto the floor, and I wrap myself in a towel and I just kind of sit on the floor on the drying mat for several minutes until I have my bearings back. Or sometimes I'll go straight over to the bed, lay my towel down, and just lay completely naked underneath a fan on high so that I can cool down and try to get my bearings back a little bit quicker. And that's really about it. Oh, you can see my wine rack over here. So I know the bathroom is like the worst place to store wine because it's super hot and humid in bathrooms, of course, and that's the opposite of what you want for wine. But this is where I like to enjoy wine, is in the bathtub there. A little half a glass of red wine with a bath is super relaxing. But anyway, that is pretty much it. I hope you enjoyed the video today of all of the kind of little life modifications that I make throughout the day that seem pretty subtle but are very typical of someone with hypermobile Ehlers-Danlos syndrome. So hope you enjoyed. If you liked this video, please click on the like button. If you want to see more videos like this, subscribe to my channel, and don't worry, it's completely free. If you want to be notified when I release new videos, just click on the notification bell. As always, thanks for watching, and see you next time.